Welcome and thank you for joining us. I'm Pratiksha Gandhi, and with me here is Dr. Brian as well. He's a leading lifestyle-focused cardiologist, who brings not only his expertise but also his personal journey of transformation to this conversation. Welcome, Brian, and please tell us a little bit about yourself, like about your story and what excites you in cardiology and the new phase you're in.
Yeah, thank you, Pratiksha. I've been a cardiologist in Asheville, North Carolina since 2001. And I've come in 20 plus years to appreciate that really true healing ideally begins before that cardiac event, before the heart attack, before the stent, before the bypass surgery. We can prevent that event, really, if we're more intentional about how we do things. We can certainly treat the disease process in a more holistic way if we choose. And in some cases, frankly, we can even reverse that disease process, and we can talk more about that. Happy to jump into a little bit more about my story if you'd like, related to that. So it was about 2013 or so, maybe, when I met a patient named George who just changed everything for me. I was a very traditional focused cardiologist until that point. I was also a board certified lipidologist, so I was a cholesterol expert and was in charge of our lipid clinic and managing patients with lots of medications and procedures. And there's a role for those things. But George came to see me because he had had 2 bypass surgeries and was having exertional chest pain called angina every day. It had been recommended to him that he have a 3rd bypass surgery. He had already had 2. I wonder if there's just a different way, because that 3rd surgery is the 3rd time's not the charm in this case. So I gave him a book called Prevent Reverse Heart Disease that advocated a more plant-focused diet and some other behavior changes. And he went off, and I saw him back 3 months later. And he had lost 27 pounds, which was great, but not really our focus in this case. His cholesterol dropped 100 points, 100 milligrams per deciliter, which I had never seen to that point. And I became really curious about what happened there. What happened? Is it representative of what happens when people change how they eat and move and think and sleep, social connections? The thing that really just blew me away, frankly, was that within a week of making these changes, dramatic changes in his lifestyle, he had not had any angina for 3 months leading up to his second appointment with me. He was taking nitroglycerin every day for relief of his symptoms. And then within a week of making these changes, he had not taken any nitro for 3 months. Frankly, I was humbled by the whole event. I did not know that that was possible at the time. And I became very interested in diet, in movement, in mindset, and I've learned a lot since then.
Thank you, Ryan, and that's very amazing story that, and I think we really need more cardiologists like you, where, like you saw firsthand that after stents and surgeries, the symptoms recur, because that is what is happening in standard care, just like kind of suppressing the symptoms. And what you have been doing here, like my story is like way back in 1997 when I was like a hospital owner. And that way, we didn't have insurance much back then. And I had a similar story where a person was advised to open heart surgery, but he could not afford it, and we become doctors to help people. And, like it was like emotionally challenging for me that what to do with this patient. And that's where, again, I'm also like a trained yoga and meditation teacher. So I worked through the yogic lifestyle. And then I saw that in 3 months, the treadmill improved, the echoes improved, and no angina. So I think what we are talking about is a healthy heart retreat, where both of us are going to bring all this experiences, learning, and our journey of more than, I think, like totally all our combined expertise will go to more than 50, 60 years. Capsulated in 3 days, right? In our amazing workshop. So let's go a little bit about why do you feel people should be coming to this residential retreats, and how will it help this heart patients, to come over, like with what we are doing?
Yeah, I've always felt that there are three sort of legs to the stool, if you will. The first leg, the first piece is education. I think we all generally know we should be doing a better job of how we're eating, how we're moving, even how we're thinking. And we really don't know the details. We don't know as much as we need to know to really be able to frame it in our minds of how we're going to actually make these changes. So I think the first person is detailed, or first piece, if you will, is detailed education, and then it's integration. How do we integrate what we've learned into meaningful behavior change? Because with these things we're going to be talking about, it's ultimately not about what you know. It's about how you're living what you know. And then the third leg of the stool, and this one's a little tougher, is how do we arrange our environment so that we don't backslide? How do we make the healthy choice, the easy choice in our daily lives to continue to support the changes that we've made? So education, integration, and then environment redesign, if you will, so that it supports these changes over the long term. So I'm really interested to hear about how we can, from you, how we can do those things at the retreat.
Right. So, like my experience has been when I have been doing like many people, even they do lifestyle changes, but still they do have issues. So I have been working a lot to non-invasive therapies and especially external counterpulsation. So what I would do is that along with external counterpulsation, I will have all these people into workshops. And actually, I've written a book also, Living Without Heart Surgery, where people were told heart surgery and almost 20 years avoided it. And one thing what I remember is 3 days which they spent with me in the workshop period. Like that's what they always tell me, and this is the main reason why we are doing this retreat where they don't get opportunity. Actually, when people are in standard care, it's like 15 minutes. They don't get the opportunity to sit and relax and talk. And what we are doing in this retreat is when they are there from morning to evening. So we are going to do yoga together. We are going to eat, like freshly prepared meals by our holistic chef from the farm to table experience. Then we are going to have groups, because what is the power of groups, which you have also seen in your programs, is that when people having similar situations in life, like heart and heart attack survivor, or having cholesterol, high blood pressure, diabetes, or they're having genetic history, when people with same thing come together and they start sharing their stories, oh my gosh, that brings in so much of deep bonding and connection. And I had like participants in my workshops who used to say that, oh, attending, I had 5 blockages, and in 3 days workshop, I think my one blockage is already gone, like kind of, because they felt so light, So I think this is the beauty of retreats, because it brings in a lot of connection and support and education in a very peaceful environment.
Totally agree. It reminds me of in my professional career, one of the things that I did that I really enjoyed the most was I was the medical director of our Ornish Lifestyle Medicine program, which is an intensive cardiovascular rehab program. And we focused on nutrition, on physical activity, on stress management, and on group support. And the way Dr. Ornish simplifies that is eating better, moving more, stressing less, and loving more. And what I'm hearing you say is that it's that love more piece, which is ultimately the glue, which sort of allows everything else to be held together. And I love that. And I agree with you that, when we're in an environment where we can be authentically ourselves, a lot of healing can occur. So thank you for recognizing that and creating the space for the magic to happen.
Yes, thank you. And I think this is something which is very important is when they get that time with their doctors from morning to evening, like, 8 to 9 hours, and where they can ask any questions without any fear. There are, like, without any filters. They can just pour their heart out, and then they have this whole group, and there are authentic answers, honest answers. That really creates so much of healing, and it's like a permanent like kind of things carved in the mind. And this is why we invite all the people who are listening to this kind of a retreat experience, because this is something, it's an experience. You're investing in an experience, because this is something which cannot happen in any kind of a office setting. So before we leave, what would be your points, your giveaway points to the people who are considering joining this retreat?
I think that's an excellent question. And I think it's important for people to recognize that while this is going to be a great fun, great food, beautiful setting, it is not just a vacation. It really, you mentioned an investment. It is an investment. It's an investment in your future. And our experience is that maybe this is worthwhile if people are simply curious about making health changes, but we see the greatest opportunity and the greatest change in people who come to this retreat and they are really ready to dive in, put their whole selves into the effort, and are really ready to make these changes that are going to set them up for optimal health in the future, not just physical health, but physical, mental, emotional, and spiritual health. So if you're not sure if you're ready, you're probably not ready. If you know you're ready, then this is your opportunity.
Yes, thank you, Ryan. And that's so true that this is not definitely a vacation or people with curiosity. This is really for people who are serious about making the changes, who are tired of being tired, and sick of being the sick care, being with the sick care.
Right.
Because what we are building here is like a healthy heart community, where we are bringing people together under one roof in this beautiful setting where they can learn about their heart health blueprint. Because and we are going to talk about very interesting topics, like, most commonly asked is about cholesterol and statins, and the way. And I think these are the burning questions which everyone have, that how long do I take the statins, and is there any alternative, or how to lower my medications, and oh, I don't want, my father got stents or surgery, and whether should will I have. Because many times I have seen, in fact, I have heard from patients that uh, oh, your father had a heart problem and had done a surgery, even though you don't have symptoms now, but you have to do a bypass surgery. I literally have patients signing off on surgery papers as their destiny, their genetic destiny. But we are going to break all these myths that you're not your genes, and you may inherit those genes, but you don't have to suffer from that disease or that problem. So I think uh, it requires a lot of what we say mindset for the people to accept these truths. And what we are going to give away is actual tools and education, and all the challenges which we'll be putting them through. They will be getting actually roadmap on how to go and live with it. So I think that we both have made our points. Thank you for watching this. Me, Dr. Pratiksha Gandhi, and Dr. Brian, both of us are very excited, if you are ready, to welcome you for this retreat. And we hope to see you guys soon. Thank you.